Hi everyone, this is Dr Abdullah Saleem. I am a consultant pulmonologist and sleep medicine, Care Hospital, Malakpet, Hyderabad. I have done my specialization in respiratory diseases and sleep medicine. Today friends, I want to discuss a little bit about what is sleep apnea, what is sleep medicine, and what are their causes, how to treat, how to diagnose it, and how to prevent from sleep apnea. Sleep apnea is most commonest, deadliest disease in the history. It is always be ignored and unrecognized by the patient himself and some professionals. Human body spend 30% of their life in sleeping. There are various forms of sleep apnea such as obstructive sleep apnea, central sleep apnea, and obstructive hyperventilation syndromes. So we'll discuss about what type of sleep apnea is more common. Firstly, the obstructive sleep apnea, which is a more common form of sleep apnea, in which your airways got collapsed or obstructed during sleep. This results in the decrease in the airflow in and out of the lung. This results in decrease in the oxygenation in your body, BP fluctuations, uncontrolled sugars, risk of cardiac arrhythmias and cardiac failures has been noted. Central sleep apnea is another form of sleep apnea in which your body, your brain doesn't give an adequate amount of information to the lungs to pump oxygen in and out during the sleep. Both the form of sleep apnea are easily be treatable and preventable. Obstructive sleep apnea is the most common form of sleep apnea. This sleep apnea, the common risk factor of obstructive sleep apnea are increased obesity, high BMI, intake of alcohol, excessive junk food, sedentary lifestyle, unhealthy and disturbed sleep. Other factors include the anatomical disfiguration of your lower mandible, congenital anomalies of face, and male prevalence is more in the male population has been noted as compared to female. And the last is the genetical predisposing factor also contribute the major roles in development of obstructive sleep apnea. The common symptoms of sleep apnea are fatigue, excessive daytime somnolence or excessive daytime sleep, fatigue, loss of concentration, loss of memory, facial puffiness, headache, which is seen in the later stage of obstructive sleep apnea. An individual who is suffering from sleep apnea may develop cognitive impairment in the later stages or advanced stage of sleep apnea. The diagnosis of sleep apnea is easily done by the sleep study or polysomnography, in which this machine is connected to your body when you are going to sleep, and this polysomnography records your oxygen saturations, BP, your brain activity, your heart rhythms, your movements or the limb movements during sleep. It gives information about your pattern of sleep, your hygiene of sleep as well. Treatment of sleep apnea is done by the pharmacological treatment and non-pharmacological treatment. That means the sleep apnea patients has advised to use for PAP therapy, that is positive airway pressure. In this, doctor will prescribe you a machine which is connected to the mask, and the individual has to be sleep with the mask. And these machines give you continuous airway pressures inside your lungs so that the air should go in and out of the lung without any obstruction in upper airways. There are different forms of PAP therapies, that is CPAP or the bilevel positive airway pressure, which is described depend upon your sleep study and your clinical presentation. The complication which is encountered if we don't treat the sleep apnea or obstructive sleep apnea are cardiac arrhythmias, atherosclerosis, hormonal disturbances, metabolic disturbances, uncontrolled diabetes, cardiac failure, and risk of stroke is increased. The most other common form of treatment includes pharmacological treatment, such as few medication has been used for the treatment of sleep apnea as well, which has some role in some extent. Secondly, the surgical treatment such as uses of dental implant, surgical correction of mandibular disfiguration, etc. And this is the commonest. We can treat the obstructive sleep apnea easily.